You're listening to Online Pet Health Webinar Podcasts with your host, Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealthwebinar.com.
Hey everyone, welcome to the Veterinary Rehabilitation Podcast. I'm your host, Dr. Megan Kelly, and today we've got Angela Griffiths from the Greyfriars Veterinary Rehabilitation Referrals in the UK. She's no stranger to our podcast. We've had her chatting before. I think our last one we chatted about was breeds and hydrotherapy. So it's great to have her back on the show today to chat about a rather controversial topic about whether we should or shouldn't be using harnesses and life jackets in different hydrotherapy situations. So welcome, Angela.
Hi, Megan. Great to be back.
Thanks, Angela. I know you're busy and I really appreciate your time. This is a topic which I think that we're going to have a lot to chat about. And what I wanted to do is actually just to divide it up into sort of starting off with talking about swimming and underwater treadmill in different times, because I think that sometimes when we think about hydrotherapy, we often just think about swimming, but we obviously have the underwater treadmill too. So can we start off by chatting about the pros and cons, basically, of using a life jacket or harness, if you want to separate them, just for the swimming for the moment?
Okay, so if one of the reasons, or the main reason that we use a life jacket is because many of our patients are post-operative or weak or have been in pain, and that's the reason they're being referred to us. So although they may in the past have been good swimmers or potentially even still be good swimmers, what we need to do is guide them in the pool, show them where we want to go, and have some control. We find with the life jacket, because it's stiffer and more stable, we've got a bit more control over their direction and body position. But the main number one reason we use a jacket is to protect airway. And we don't just rely on the jacket, it just helps us. A lot of dogs swim very low, especially when they're weaker, and you've got their mouth at waterline and you've got risk of them ingesting water, and that's something we have to resist. So sometimes people will say, yeah, but if they're in the jacket, they're not kicking. My priority is get the dog comfortable in the water, able to swim, able to move, and then people sort of get an idea that hydro is just swimming in the pool, and yet we do so much more. So yes, I want them moving, I want them to get stronger, I want them to increase their cardiovascular fitness, their muscle strength, their range of motion, but I also want to improve their proprioception. We want to challenge them, and out of a jacket, we find for many dogs being buoyant, possibly for the first time in their life, possibly they've never swum, is very difficult. So we're helping them. The aim very much, say, if we take an example of a young dog, perhaps 9 months, 1 year old, being referred with hip dysplasia, is first, potentially, we have to teach them to swim. So they start in a jacket, so we get them comfortable. They seem more they feel safer. It's a bit like a thunder jacket kind of a thing, I think, for them, that they feel comfortable, they're happy in the jacket. We can concentrate on them swimming and getting them strong. And then the aim is to get the dog out of the jacket and potentially swim in 25 minutes out of a jacket. But we might, in our session, start in the jacket just to get them familiar with swimming. Because those hip dysplasia dogs, we want really moving. It's not much use for us to just have them doing a little bit of walking or standing work or sort of in a very small pool going from A to B. We want them really dynamically strong because we need that carryover onto land. So they start in a jacket, get them comfortable. Then in future sessions, they may start in a jacket and warm up, come out of the jacket for the middle of the session, and then as they tire towards the end or we do a warm down, then they might go back in the jacket. But the aim is out of a jacket, really fit, strong, dynamically strong swimmer in that example, but there are so many. So the pros are adjusting body position in the water, helping us to hold the dog up because we're very hands-on. One of the cons is the design of a lot of the jackets is, especially the newer rough wear ones, that they go over the head. Some dogs don't like having something put over their head, so you need to be very careful with their familiarization with that. Some of them are too tight, depends on the breed of dog, so you're restricting shoulder movements. So that's always something we're thinking about as well, because dogs generate 80% of their forward and upward motion with their forelimbs when they're swimming, which is why they switch off the hind limbs if they don't have a reason to kick harder. If we're restricting shoulder movement, we're restricting their forelimb movement. However, it's always a balance. It depends on the dog, the breed, the condition. All of those things have to be clinically reasoned for that particular patient. So it isn't just jacket or not jacket, it's whether a jacket or a harness is appropriate for that particular dog in its stage of recovery, its age, for its breed, its body position in the water. There's just so many things to it.
Yeah, so I mean, what I'm hearing is that it's not a either we use the jacket or we don't.
No.
We have a look at the situation, and in one day, maybe a dog, the last swim it had, would be out of the jacket for a longer time, or maybe it wasn't using a jacket, and then it comes one day, maybe it's not swimming as well as it should, maybe it's fatigued, and then you put the jacket on. So you're looking at actually the situation and deciding then what is appropriate, whether you need the jacket or you don't. And what I'm hearing from you is that safety is obviously first.
Absolutely. And then if you look, maybe we take the same dog, 1-year-old Labrador Retriever, been swimming really strongly for its life, good swimmer, started to get older, 8, 9, 10 years old, the arthritis is getting worse, you're losing strength in the forelimbs. Those dogs typically, those bigger, older, heavier labs, get very head down in the water. We call it floaty butt syndrome. And they tend to gain some fat on the hind end, and that floats and that forces the front end down. And then we're at real risk. And those are the dogs you don't have retrieving toys either. You don't want them carrying a toy because they're going to ship water. And even with a life jacket on, you're having to provide hands-on support, thoracic. You know, it's quite a skill to get in your arm there, lifting the dog without affecting their movement or their forelimb movement. So we find at the end of their life, especially dogs that don't want to rest very much, then we might be going back into a jacket to make the dog safer, make their trim position in the water higher, so that they can spend 25 minutes in the water, and half of that might actually be spent having massage and doing standing work. But you know, it's for appropriate life stage as well. And we have some older dogs who adjusted a life jacket for safety. They don't even swim, they're just in our arms. It's effectively a spa session. I've got one coming in today in a couple of hours where she's 12 years old, she's not walking, it's end of life care, and it is just, she loves being in water, she's very comfortable, she relaxes. So that's an appropriate dog for a life jacket. Just in case she slips or moves, she's going to be held above the water while we adjust positions.
So those dogs that you have in the water with a life jacket and then you take it off, do you then slip a harness onto them? So you alternating between a harness and a life jacket?
Most situations we do. If we're swimming the whole, for instance, we may have the harness on under the jacket ready, so we don't have to mess about in the middle of the session. I prefer to have a harness on so I can guide the dog, because what I don't want to be doing is guiding dogs by their collar in the water. If you think about you're swimming and then someone gets hold of you around the neck and pulls you around, it's not a pleasant experience. And we had some fun in Cape Town actually with some of the students, getting them to feel how it feels to be held and moved around and having no control over your position in water. And it's actually quite frightening. And for many breeds, we may not even be able to have a collar on, brachycephalic breeds, for instance. So if I need total control. I don't want the dog getting out of the pool or moving away or approaching another dog or going in the wrong direction. And I would prefer to have a harness on. So I may be hands off while they're retrieving or coming back to me, but I've got a harness on to actually have some control when I've got hold of the dog. And I don't want that control to be via the neck. If you think about it in the pool, they're not grounded, they're not standing, so they're very vulnerable to spinal column movements. And you know, and actually going back to spinal column, if we think about that, that's another reason why we use a jacket in the pool, because if the dog's very lordotic in the pool, so you tend to have front end and hind end floating higher and sort of from thoracic through to lumbar dipping, we don't want that situation in the pool, and we're protecting spinal position. people, the equivalent is if you have a back problem, which I do. I've had 3 disc extrusions. Swimming breaststroke is very uncomfortable because it puts you into extension, and we don't want the dog in extension. For instance, if it's had spinal surgery, that's why we usually try to go to water treadmill, but that's not always possible with every dog. So that's the big bonus, I think, with using a life jacket, is that we can protect that spinal position. And yes, that just protects us on a sagittal plane, but we've also got to be hands-on to prevent rotation as well.
One of the pros you mentioned was limiting shoulder movement, and it just makes me think about the different types of life jackets that are available.
Yeah.
So, I mean, you can see that there's some recreational type of doggy life jackets for people that are boating, and they're very different to the ones that we would recommend for therapists to use. So can we chat a little bit about your ultimate life jacket? So what the design of it would be, if you can describe it, and the things that we should look out for that could potentially maybe be uncomfortable for the dogs. I think that sometimes some of them are the design, they don't have padding, or they just have 1 or 2 straps, and then the design that we would prefer that would prevent that shoulder movement restriction.
What you really, I don't think the perfect life jacket exists yet. We're actually trialing some different makes, and they have advantages and disadvantages between them. But from my point of view, I'm always looking at a really high cut on the shoulder, padded round the front, round the neck. My preference would be a fully adjustable front of jacket. The newer rough wears are quite difficult to pull up tight. I want the jacket to sit fairly forward on the dog, so on the nape of the neck. So you don't want a big gap from the back of their skull to the start of the jacket, because if you think about it, the flotation's towards the back end of the dog, and that will naturally tip them down and forward. So you want to, even when you put that jacket on, think about the position and bringing it forward, so you're giving the maximum thoracic support. And absolutely, you do not want just all the flotation on the back of the dog and 2 straps underneath, because that enhances that spinal extension that I was just talking about. We want the lift provided by the jacket from underneath the dog, and that's obviously where we always put our hands as well. We want to be pushing up rather than lifting up with the jacket, either with our hands on the jacket or the jacket itself. Some of the jackets are longer, and again, you can then have too much flotation towards the hind end, which tips them forwards. What I'd really like is a jacket that has a Dachshund extension. So for those really long dogs, we need a bit more length. And you often find dogs are in betweeny sizes. So they're too short for Dachshunds, and they're too tight across the chest for pugs and French bulldogs. So we don't have the perfect hydrotherapy jacket yet, because all of the others are designed, all of them are designed as lifesavers. But I think some of the life-saving jackets are actually really detrimental to the dog. If you put them on and look at how they are in the water, they almost put the dog at more risk. They just keep it afloat for a few seconds, so you can use a boat hook and pull them out. And this is always the thing. Yes, you might keep the dog floating, but you're not necessarily keeping the dog floating the right way up. You know, there's a lot of design goes into human life jackets to ensure the airway and head is protected.
So, I mean, obviously there are different makes of different life jackets, and depending on the breed and the length of the dog, you might be choosing a different type for a specific patient. You were mentioning you don't want it to be too long. Where would you like to see the end of the life jacket end? So where's the last point that it should be?
Yeah, good question. I think potentially just past T13, I would say, is about right. Maybe slightly longer with the Dachshunds, but about there. I want the lift at the front end, really. I don't want to be, so I suppose what you've got to look at is where is the center point, the center balance or center flotation point of the dog, and you want the lift to be forward of that point.
Yeah.
So it's different for different breeds. The thing that
Yeah.
affects it is chest size, chest capacity. So if you compare, I don't know, a collie or a Labrador with the chest cavity that you've got on a greyhound or a Great Dane, massive difference in their shape and their flotation. So one of the problems with those kind of dogs, and the Dachshunds come into this, is that when they turn, it tends to be that the thoracic cavity, the lungs, want to come to the surface. So as they turn, they'll tend to tip over. And that's a really useful thing when we've got a jacket, because you think, okay, we're adding more flotation, we're making it worse. But actually what we're able to do is be hands-on and just help them and control that so that we keep them more stable through the turn.
Yeah, I mean, I think it's one of those things that people that make products for humans have it so much easier. I mean, the choices that they've got a few different sizes, but for people that make products for dogs, I mean, there's just so many different lengths of bodies, sizes of chest, lengths of legs, and you know, I think about sort of, for example, things like making braces. I mean, we get short-legged dogs, long-legged dogs.
Yeah.
There's so many different shapes and sizes, so it is difficult. And like you say, we're never going to get the perfect life jacket, but we want to try and get the best fit that we can for the patient. Let's chat a little bit about.
Can I just say one thing, Megan? Sometimes we have to add additional flotation to the front of the jacket because there's not enough there. So we either use swimmies or armbands to do that. But I'm looking at some modifications at the moment that we're working on to kind of come up with a better jacket or some adjustments that we can make. And one of the big things would be to add extra flotation under the thoracic cavity. So that's something that we're looking at and trialing at the moment.
So is that the area that you tend to add to mostly?
Yes, definitely. Yeah.
And you said you'd use like a floaty. So how would you attach it?
So it would be at shoulder level, basically. We'll add on like an armband, like a child swimming armband flotation. We add it there. It's not perfect, and one of the things you have to be really, really careful about is that you're not then adding pressure to the throat because you've moved that flotation or lift forwards, and that's a problem. So one of the things I would absolutely ask people not to do is, you know, you hear the dogs are flapping their ears, they're getting water in their ears. Well, they're doing that because they're too low at the front end, and you need to be hands-on and adjusting that. What you shouldn't be doing is adding an inflatable collar around the neck, which a lot of people do. You see that on a lot of Facebook sites and websites, because what you're doing then is you're putting the neck into extension, which we don't want to do anyway, because as soon as you do that, that restricts forelimb movement and shoulder extension. But the other thing is, if you think about it, you're providing lift under the esophagus and the trachea, and you're, you know, potentially going to compromise airway there. So exactly the dogs that have a problem that are low in the water are exactly the ones that you don't want to add that flotation under the throat. So that's something that to me is an absolute welfare issue and shouldn't be done. And lots of people will go, I've done it for years and it's fine. But really, really look at those photos and look at that position and really understand what happens when you put a dog's neck into extension. And you can experiment this with your own dogs. Put the neck into extension and now look at your protraction of the forelimb and how that's affected.
Yeah, so first prize is basically to get it underneath the thorax, to lift from that area there. Yeah. Great advice. Angela, should we chat about the underwater treadmill now and the pros and cons of using a life jacket in the underwater treadmill? I think we've covered the pool.
So obviously there's two ways of using a treadmill, both static and which we talked about on one of our training videos, and with the belt moving. Very many, we're probably a bit biased because I just have to look at my patient population. So many of the dogs that we look after in the water treadmill are spinal injury dogs, post-operative or spinal condition, and they have a great deal of trouble actually stabilizing themselves in the water. And what I do with my students is I get them to walk in the water treadmill with the water deep, and then we say, okay, we're not going to give you any support, get you walking. Then we actually put our hands on either side of their shoulder or their hip, so we're putting pressure on from each side, and they like it. They feel much safer, they're less disturbed. You take the hands away and they wobble. And it's very like that for the dogs. We're kind of giving them a helping hand, because what we want the dog to do is track parallel with the sides of the treadmill. We don't want them turning 10 or 20 degrees left or right. We need them to be working in line with the treadmill, because otherwise, if we're taking the hind limbs back, we're taking them out into abduction. So we're using it because it's quite a stiff jacket, because it lets us stabilize the dog in the position that we want it in the treadmill, parallel with the sides, pointing forwards. What I don't like to see is film where dogs are wandering all over the place, they're hitting the side plate, the back plate, that kind of thing. It's very important to us that the dog is stable, so that we can then affect their gait. However, some dogs are really strong. If we're doing fitness or something like that, or we're training for sport, then the dog will probably be in a harness, because I don't want to affect their movement with the life jacket. But again, it comes back to that protect the dog at all cost. We need something stiff enough. Also, a lot of the dogs will trip forelimbs, so that we've got something to get hold of to actually hold the dog and stop it tripping and going down at the front end as well. So a lot of the cervical spinal injury dogs we look after, we're providing support over the shoulder girdle. We've got hands-on to provide thoracic support, and hands-on hips, greater cranters, or giving dorsal and ventral pelvic support to stabilize the body position so that we can get good gait, because that is the whole aim of the treadmill. The worry is then obviously you're not letting the dog do anything for itself, and it won't switch on its muscles. But it's actually, they're still doing a lot of work, and we're giving the minimum support that we can. So it's not that they don't use their abdominals or their stabilizing muscles or epaxials at all. It's just they may use them less. But a lot of my patients, without that support, just cannot get good gait and cannot walk. And the aim again is to not need to use a jacket later on. But sort of the dogs I look after, I find, need maximum support and help, and without that, the treadmill is not an effective method of treatment for them, because I'm trying to get their gait better.
Yeah, I mean, I think about, when I've used it, especially in those large breed dogs that are paralyzed, it really just helps you to be able to support them so that they're not falling all over the place. It really gives you a lot of control. You mentioned that life jacket that you said is quite stiff. What brands of life jackets could you recommend that you're using that you found have been useful, and if they're different for the underwater treadmill and hydrotherapy, if you can just tell us that.
Pretty well. We find that the rough wear float coat is the best one. I can't actually name any other brands, because at the moment I'm just on the spot there. But I think we've just tried lots. I think there's Outward Hound is one, and it's just the most effective jacket for what we do, and it's multi-purpose. We can use it for both. I like the stiffness because you can move your hand position, so you can have someone supporting front and back of jacket just in the center, because you always try and mirror. So you either have someone in the center or you have two people, so you're mirroring. And I find often the dogs that need the most support, our hands need to be almost at water level, so you're giving the most lateral stability you can. A lot of these dogs have lateral or side flexion with the spine, and again, we're trying to provide support to reduce that side flexion as well. So I just find the stiffness of that particular jacket the best. I remember going to do an audit or an inspection one time, and some people were swimming a Great Dane, and the jacket they were using, whose name I can't remember, almost acted like angel wings or water wings. It was just floating on the water, and it wasn't providing the dog any support at all, and there was no point in it wearing it. It was actually just making life difficult. So I think most of us that are working in hydro can see whether the jacket's doing the job right, and we're all going to have personal preferences. It may be different in a smaller pool as well, that you may find, because the dogs are not swimming very far or doing as much active work as we might be doing in a bigger pool, that then a different brand of jacket may suit your purposes better. And it may be that a harness is fine. I think the thing we all need to be aware of is that what we don't do is use harnesses or jackets as a substitute for us being hands-on and supporting the dog and being by their side. And always the priority is protection of airway. Everything else is secondary to that. And often clients will be looking and saying, oh, they're not kicking their legs yet, but they will when they're confident and they're stronger. My priority is always to make sure that dog does not ingest any water or trip or fall in the treadmill.
Yeah, you were chatting about using the jacket if you're not in the pool, and I've seen some pictures. You see them often on Facebook, of dogs that there's like a D-ring on the life jacket, and then there's like a rope, 2 ropes that are tying. I mean, I know that's something that you would not recommend. You definitely are in the pool with the patient. Something like that. That's what you're thinking, right?
That actually is to me, it's an animal welfare issue. So let's deal with it in 2 ways. So the first thing is the dog's in the water, it's in a jacket, you're not affecting its position in the water. You also can't feel if you've got patellar luxation, crepitus or whatever, you can't assist the dog. But also if it gets into trouble, you're not there. And you've got to think about, you're tethering that dog in one position, so you're adding resistance. I dealt with a really tragic case a couple of years ago as an RSPCA prosecution in the UK, where the dog was in a hoist and it was in what's called a hydrotherapy sling, which again, I think should not be sold as that product. So you might use a hoist to get the dog into the water, and you should be supporting as you would a human in that situation, but the dog needs to come out of the harness once it's in the water, because those harnesses specifically really restrict falling movement. So imagine being put in jets and the jets are on and you're swimming for your life and someone ties your hands together, because that is what we're doing to those dogs. Anytime they can't swim, anytime they get tireder, they start to go lower, their head comes down to the water. And I've seen a video of a dog who died doing exactly that. And that's why I'm so passionate about it. And that's why we have to get people to understand you cannot call that hydrotherapy. And we can't rely on owners because they don't have the experience to understand. They think the dog's kicking really, really hard and doing really well, and they don't realise that the dog's under severe distress. The film I watched, the dog had whale eye, it was blowing bubbles, it was turning on its side trying to get air, and none of the people in the room were aware that this dog was in severe distress. And when I reviewed the notes, the dog had been distressed on every hydrotherapy session it had attended.
Yeah, guys, so a life jacket is not a substitute for you guys to be in the pool doing what you should be doing. Angela, you mentioned about the life jackets, inhibiting the epiaxial muscles, and I think that there are a lot of therapists that have an opinion that that's why we shouldn't use life jackets, and this is where it becomes a little bit controversial because everyone has their own opinion. Yeah. What is your feeling on that?
I think it's patient specific. You're not going to switch off, the epiaxial muscles, because I think really you'd have a sort of a jellyfish situation on your hands, if I want to be, a bit controversial about it. They obviously don't. The problem is we don't have enough research. And the other problem is that people take research on a very small number of dogs, or 2 or 3 different types of research or research projects, and they put them together and I saw it recently with a lecture I saw on nutrition, and they come to a conclusion that fits the mindset. And we're working in evidence-based medicine, so the opinion I'm giving is based on 18, nearly 20 years of hydro, with seeing 10,000 dogs a year of huge variety from young to old, different conditions. But it's obviously anecdotal evidence, but there's lots of us that are working in the same way and have come to the same conclusion, who work day in, day out. But it doesn't mean you're discounting someone else's method or how they do things, and it doesn't stop you thinking, going, actually, that's a good point. Maybe we should look at doing things differently. And obviously, one of the things we do differently now, a lot more than perhaps 10 years ago, is using the water either in the treadmill or the pool just as a supportive medium, so that for dogs that are weak, that can't do land exercise, we can do cranial caudal sways, lateral sways, proprioceptive work, massage with the support of water, helping to keep the dog in a good position. And I do a lot more work now, I would say, with the treadmill static, just using it as a flotation tank. And it's absolutely superb for us to be able to observe and film and look at slow-mo and see how the dog's working and compare between, you know, week 1, week 4, week 8, and see how the dog's doing. So we're all open to change. We're all open to persuasion. I'm very, very much guided by my veterinary physios, who are human physios first, and then postgraduate diploma in vet physio, and then their MSCs as well. One of my physios is a consultant level physiotherapist for spinal patients in the NHS in UK. So she's at the forefront. She gets all the early research, with research papers, those early education, and vet world tends to lag 4 to 5 years, in my experience, behind. So we're still trying, say, surgeries for replacement discs, whereas in human world, they've said actually it's not an effective repair. They're looking at, you know, figures. I'm not going to quote studies because I don't know them, but I have read them where they've actually moved on. So and the other thing is that all of the work we used to do with spinal dogs was based on core strength. You always hear that phrase, we need to get their core strong. And now the move very much in human medicine is all over strength, dynamic stability, and strengthening the whole of the human or the whole of the dog, so that they're effective in real life. You know, dogs don't just work in one plane. They turn left, they turn right, they go up and down stairs, they jump on and off things that they shouldn't. And we need to be getting them strong in every direction and getting that carryover on land to protect them and give them better quality of life.
Yeah, I mean, I think that definitely we know that we need to do more research, and especially in the hydrotherapy field. You know, on Onlinepethealth, our members get a video once a month called the Research Refresher. And when we were looking for hydrotherapy research, there's very little of it. But I think if I think about it, you know, if, for example, that life jacket does slightly deactivate the axial muscles, there's a point in which when we're trying to strengthen the axial muscles, and there's a time when that is not the priority. So when you put a dog into the pool, the only thing we're trying to do is not trying to strengthen the axial muscles. So there is a process that we go through. And as you say, and you've highlighted really, that safety is first. And we are trying to eventually then get them out the life jacket, when then we would start to be working on all those other things like activating axial muscles and getting movement. And so, you know, in my opinion, I just feel like it's not a no, you use the life jacket or you don't. And I agree with you. I really think that using it when you need it, depending on what your outcome is that you're trying to look for. So if you're trying to strengthen axial muscles and the dog is strong enough, is able to swim, so and they can have their head high enough that you can protect their airway without the life jacket, then great. Then that's one of the goals. You strengthen axial muscles.
But
thanks,
Angela. I agree with you. I have situations where there are 4 people supporting the dog in a life jacket, or 2 life jackets even to get them standing. And our priority is to get them from lateral recumbency, a totally recumbent down dog, to actually standing. That's our priority. That's our number one. And then everything else comes on after that. But if I don't get that dog up and standing and doing some movement, we're going to lose that dog. And that's what we face with those cervical spinal dogs every day of the week.
Yeah, and I think also for different conditions, we're trying to strengthen different areas. So, you know, we're not only always focusing on the axial muscles. So I'd love to see if someone has done some research, and if somebody's listening, to research into this, because I think it's so interesting. There's so many things, so many questions that we all have. And right now we're just sort of working on our experience and anecdotal things that we found. So guys, those of you that are researchers out there and you're listening to us, please, we're calling on you. Get into research and let's start researching all these things. Angela, thank you so much for all your advice and everything. You always have got so many things to share, and every time I speak to you, I learn so much. So thank you so much for your time. I really appreciate it, and looking forward to getting you on the podcast again to talk all things hydrotherapy.
All right. Thank you, Megan. It's been a pleasure.
For more information on continuing education opportunities for veterinary rehabilitation therapists, please go to www.onlinepethealthwebinar.com. Thanks for listening, and don't forget to subscribe to my podcast so you don't miss out. I'm Dr. Megan Kelly on the Veterinary Rehabilitation Podcast. Bye for now.